Thank you very much, Jindai. It's a pleasure to be here. I'm Dr. Vic Kapil. I'm the Chief Medical Officer and the Associate Director for Science in CDC's Center for Global Health. And I'm filling in today for Dr. Jordan Tappero, who unfortunately couldn't be here due to a personal emergency. So I'd like to thank the Committee on Global Health and the Future of the United States for the important work you're doing to develop this report, and particularly in light of the upcoming transition in administrations. I will try to weave in with my remarks, perhaps a few comments on the questions that you have posed as well, and then also, of course, look forward to further discussion. CDC has what we think is a very critical role to fill in public health. And our brand, as you can all imagine, is well recognized around the world by ministries of health. In fact, many of them want their own CDCs. We don't in any way copyright it or anything like that. We freely allow people to use the name. And in fact, there's a CDC in China, there's a CDC in India, and in a number of other countries. We're engaged in both supporting and developing, in the development and sustainment of public health capacity around the world. We also do the same type of work here in the United States with our state and local partners. And that work involves both everyday public health threats to health and well-being, and also those that come from public health emergencies. We deliver services to people around the world, whether it's through our PEPFAR work to scale up treatment for people living with HIV and AIDS, or through our work as as a co-implementing partner on the President's Malaria Initiative. However, we do this all not alone. We do this all in partnership, and we're very committed to fostering and improving those partnerships with both the public sector and also private sector partners. Collaboration from our perspective is really key and is critical to the work that we do worldwide, particularly so in our global health activities. I'm actually thrilled to see, if you just look around the table here, at the sponsors, every single agency here, to my right, to my left, are people that we work with day in, day out. And we could not do our work either here in the United States or overseas without the excellent working relationships that we have with these folks. We're a relatively new center at CDC. CDC has always been in the global health space. We've always done a fair amount of work in the global health arena for decades. However, most people associate our work with infectious diseases. I do also want to point out, as Ariel mentioned a few moments ago, that if you look at the leading causes of death and disability globally, certainly non-communicable diseases are growing, and some would say actually at epidemic levels. And whether you're talking about cardiovascular disease or diabetes or cancer or injury prevention and control, these are very, very important problems in low and middle income countries, as well as here at home in the United States. So our work in public health has, I think, over time also evolved and continues to evolve to reflect those changes in demographics, in epidemiology, in the challenges that we face. There have been, of course, as has just been mentioned, significant U.S. investments in global health, and we've really made remarkable progress in some areas since the IOM published its report in 1997. However, infectious diseases remain a significant threat to the health of the public. The world is increasingly interconnected. We don't know when or where the next threat will emerge, and we've seen that recently just in the last couple of years with Ebola in West Africa, and now more recently with Zika. And we've tracked, in addition to these, hundreds of other outbreaks as well in over 100 countries. most of the world, and this is I think, something that bears specific mentioning in light of your questions 1 and 3 about internal versus external focus and what factors may shape the agenda. Most of the world is still underprepared to effectively prevent, detect, and respond to urgent health threats. And I'll say a few more words about our global health security activities, but as recently as 2014, fewer than 1 in 3 countries self-reported being fully prepared for outbreaks. Emerging infectious diseases greatly affect low and middle income countries, perhaps disproportionately so because of their infrastructure challenges. But of course, they also affect the United States, and they have far-reaching consequences, not just for the U.S. public health system, but also potentially for economies, both our economy as well as other country economies. Antimicrobial resistance was mentioned earlier. It's one of the most pressing public health issues that faces the world. Aggressive public health action is needed, and it needs to be coordinated public health action with the international community. We need to slow the spread of resistant organisms and also improve how we use antibiotics. There's a lot to be done in this area, and it isn't just in the public health sector, and it isn't just in the health sector. It involves everything from infection control in hospitals to all the issues surrounding antibiotic stewardship and how we use antibiotics in communities, how the healthcare sector and healthcare providers use antibiotics, but also expectations that the public has regarding antibiotic use. So much needs to be done at a societal level. We have a long history, probably a 60-year plus history of implementing evidence-based global health programs, eradication of smallpox, now more recently our work with many partners in the area of polio eradication, HIV prevention and control through our PEPFAR activities, and we've made good progress, as I mentioned earlier. However, even with polio, even though we've made remarkable progress, the challenges remain. We have a decreasing number of cases. We're down from perhaps 350,000 cases to tens in number cases of polio in very challenging areas of the world. And so the need, as we have seen recently with new cases in Nigeria, the need for surveillance, the need for laboratory capacity, the need for infrastructure and health systems that can address these issues remains and will remain for quite some time. We work very closely in the work that we do in other countries. We work very closely with our partners in those countries, particularly the ministries of health. Today, CDC has approximately 1,700 staff in over 60 countries around the world. Most of these individuals are based in CDC offices within or attached to U.S. embassies, and they work directly with the ministries and with many other local public health institutions in those countries to build long-term, sustainable capacity and relationships. Most of these staff are country nationals, over 1,300 of them, and the rest are Americans who go from the United States to live in those countries. We also support detailed staff, over 40 staff, to international organizations such as the World Health Organization, the World Bank, UNICEF, and other partners. And CDC staff play a critical role in many of their programs worldwide as well. There is much that we can do in a number of these areas, and CDC works in sort of our core public health capacity development areas, if you will. These include the development of laboratory capacity, improvements in surveillance and surveillance strategies, Surveillance and good data for decision-making is a critical component from our perspective of public health activities around the world. The effectiveness of interventions, the trends in disease in a population, the risk factors, all of these kinds of data are critical for policymakers as they make decisions about the use of scarce resources. Strengthening the workforce and the public health workforce, and then finally responding to and preparing for emergency events. The work that we have done, again, with every partner at this table in the area of global health security is, I think, a great example of how, as U.S. government agencies, we work very hard to improve our efficiency and also coordinate our activities. The global health security is really agenda is really an unprecedented opportunity. We've received support, funding through fiscal 19. So there is a bit of a time-limited opportunity to strengthen core public health capacities through the GHSA. It leverages the investments and expertise from other donor countries as well. So we're not in this alone. It involves many other countries, multilateral organizations, and also, importantly, secures resources and commitment from the recipient countries that are participating. It builds on and strengthens the concepts of the international health regulations. So provides practical steps to assist those countries to reach their IHR goals. There are, as many of you probably know, there are 11 targets or action packages, and all very, very important components. Our work has focused in specifically in the area of laboratory systems, surveillance, workforce development, and emergency management. However, all of them are important, and we're engaged in some way, shape, or form in all 11 of those action packages, and others in the room are focusing on other aspects of those action packages as well. We've already made important progress towards achieving these global health security agenda targets and assisting these countries in their IHR compliance efforts. However, as I mentioned earlier, much of the world remains unprepared, and there is much more work to be done. I'll wrap up by talking just briefly about the importance, from our perspective, of evidence-based decision-making in public health. So CDC's unique relationships with its partner governments, we think, provide some unparalleled opportunities to advance global health research priorities. Our focus is much more on translating the evidence and the research findings for public health action. We play an important role in global health relevant science, technology, innovation, and partnerships with a focus on implementation science and the development of rigorous methods, rigorous tools, and interventions. And there are a number of examples of that. We've been very involved, again, with many partners on development of novel diagnostics, including for Ebola and Zika, working closely with the National Institutes of Health on their Ebola vaccine trials, primarily providing in-country support, prevention of sexual transmission of Zika virus studies, looking at microcephaly and other adverse outcomes in Zika-infected patients, and so on. Our innovation activities are used to fill gaps in knowledge and are uniquely adapted to local populations and the local context. The internally versus externally focused discussions the issue that you raised earlier. We do think, as Ariel pointed out, the world is a very small place, and I think there is an inextricable relationship between our public health efforts here in the United States and our global health efforts in other countries, and vice versa. We have much to learn from them, and just as they learn from our experiences here in the United States. So I thank you very much again for having us. I'll stop there, and I look forward to additional discussion after the session.